Fatty acids, particularly omega-3 fatty acids, play a role in supporting cardiovascular health, and their consumption is associated with potential benefits for blood lipid profiles. Here's how fatty acids, especially omega-3s, can contribute to cleaning or maintaining the health of the blood. Lowering triglycerides. Omega-3 fatty acids, particularly eicosapentaenoic acid, EPA, and docosahexaenoic acid, DHA, have been shown to reduce levels of triglycerides in the blood. High levels of triglycerides are associated with an increased risk of cardiovascular disease. Reducing inflammation. Omega-3 fatty acids have anti-inflammatory properties. Chronic inflammation is linked to various cardiovascular diseases, and by reducing inflammation, omega-3s may contribute to overall heart health. Improving blood vessel function. Omega-3 fatty acids can improve the function of blood vessels, promoting vasodilation, the widening of blood vessels, and maintaining proper blood flow. This helps in reducing the risk of conditions like hypertension. Modulating cholesterol levels. While the relationship between omega-3 fatty acids and cholesterol is complex, some studies suggest that they may help increase levels of high-density lipoprotein, HDL, or good cholesterol, while reducing levels of low-density lipoprotein, LDL, or bad cholesterol. Reducing blood clot formation. Omega-3 fatty acids have mild antiplatelet effects, meaning they can reduce the tendency of blood platelets to clump together and form clots. This property may contribute to a lower risk of blood clot-related events. It's important to note that not all fatty acids have the same effects on blood health. While omega-3 fatty acids are generally considered beneficial, excessive intake of certain saturated fats and trans fats, often found in processed and fried foods, can have negative effects on blood lipid profiles and cardiovascular health. As always, individual dietary needs and responses can vary, so it's advisable to consult with a healthcare professional for personalized advice on nutrition and its impact on blood health.